just want to do a quick down and dirty about our ECIO. It is located in the ER in the bottom of the critical care cart in this bright yellow container. In there you will find a drill and two needle sizes. Your blue needle is going to be for patients 3 kilograms or over, and your yellow needle is going to be for patients 40 kilograms or over. If you have a patient who's on the larger size that has excessive adipose tissue, you're going to want to go with your yellow. All other adults, use your blue. If you forget, look at the tips of your needle. The yellow are longer. So I want to go over the two landmarks for IO insertion. These are the two most common that we use, and then I'll go over how to place it. The first landmark is going to be your proximal humerus. The proximal humerus you're going to find by placing your patient's hand over their abdomen. Place your hand into the crease of the shoulder, and then use your other hand to place in the media of the shoulder. Put your thumbs together and you'll feel what feels like a golf ball on a tee. You'll find the spot where the golf ball meets the tee, go 2 finger breaths above, and you'll feel the most prominent aspect of that humerus. Just a note about this insertion site, if you have a patient that is moving around, you're going to make sure their arm does not move. I recommend a shoulder slant or shoulder sling, because if your patient does like this, it's going to pop out. The next site is going to be tibia. You're going to get your patient's legs. You're going to want them straight. You're going to go 2 finger breaths below the knee and 2 finger breaths to the inside. You'll feel a very flat spot right there, and you'll drill. Okay, inserting. On the tibia is a 90-degree angle. On the humerus is a 45. So you'll have your needles. You'll see a hole in the hub. You will have your drill. You'll place it inside that hole. Remove the cap, and you'll take the needle, put it on the skin, press down. It doesn't take a lot of pressure. You'll feel it hit bone, and then drill. When you're drilling, you're literally going to feel a pop. That lets you know you're inside of the bone. Don't drill any further or push any further because you risk going through the bone. After you're inside the bone, you're going to want to remove your needle. You'll have this hub that twists off, and it does expose a live needle when you pull it out. There is a sharps containment device inside of these that you'll put your needle in using a one-handed technique. Then you want to stabilize your IO. You have your stabilization device that goes on just like a tegaderm. It just has a hole in it. You'll put over. If you happen to drop this, lose it, it's not in there, you can use a simple face mask and go straight over the site, and it serves as a quick and easy device. You're also going to have a tubing extension set inside of here. You can kind of see it in there. You'll hook this up. It's just like a lure lock on a regular IV set. Hook this up to the insertion site. You can flush it, or you can actually draw blood from it. You can draw an H&H and a type and screen. All other labs may be skewed just slightly, but you can refer to the pamphlet on the inside of the ECIO container that tells you more about what you can kind of draw from that. All right, contraindications to IO insertion is going to be a fracture of the targeted bone, previous history of orthopedic procedures at the insertion site, so amputations, prosthetic limbs, or joint replacements, easy IO in the past 48 hours, infection at the area of insertion, and absence of adequate anatomical landmarks. You can leave an easy IO in for up to 24 hours, and you can put most every medication through it, but there's also a pamphlet on the inside of the container that tells you every medication. I'm also going to attach a number to this video that is a 24-hour clinical hotline that you can call anytime and get exactly what you need from them. To tell if your IO is good or if it's gone bad, you will see swelling at the insertion site. If you see this swelling, it means your IO is not in. Remove it and look at an alternate site. To remove the IO, you're going to take your extension set off, hook up a syringe. I recommend a 10 cc syringe or larger just to get grip, and pull straight out. No need to put any type of pressure dressing on. It's just like a normal IV removal. If you have any questions, I'm going to attach a Word document from EasyIO that will tell you in depth with fancy words how to do this. And also there is the hotline that I'm going to send out.